Kids sick with COVID are now filling up hospitals as the number of infections continue to rise among children. And with the back to school season underway, concerns from health officials and experts starting to pile up. RT producer Roselle Reyes is joining us now with more details to this. So Roselle, can you break down this new data?
Yes, so as the highly contagious Delta variant continues to spread, hospitals are seeing more and more children sick with COVID-19. In fact, nearly 15% of all cases nationwide are children. So let's take a look at this chart. As you can see here, based on last week's numbers, nearly 94,000 child cases of COVID were reported. That's a 31% increase compared to just a week earlier with 72,000 cases.
Now, Rosa, what about the hospitals? Are they becoming overwhelmed?
Yeah, so about 1,600 kids with COVID were admitted to the hospital last week. That's according to the CDC. Now, most of those children are 12 years old and younger, and that's because they can't get vaccinated just yet. So while most of them are just being treated and sent back home, doctors are seeing a different kind of trend. Here's what one doctor from Florida had to say.
For the last several weeks, we have seen an enormous increase in the number of positive patients for COVID-19. Most of these children are coming to the emergency department, and most of them are not sick enough to come into the hospital. However, those that are admitted are sicker than what we've seen before, and many of them are requiring care in our intensive care unit.
So fortunately, the CDC reports that even though hospitalizations are on the rise, severe illness and death are rare in children infected with the virus.
I guess that's a little bit of good news to all this. So even with this rise, how is America getting ready for back to school season? I know a lot of people are worried. You're a mom yourself.
Yes, so timing for the surge isn't great. Millions have already returned to school, and the rest will be doing so in the coming weeks. So health officials, including Dr. Fauci, predict that the situation will get even worse. With a vaccination rate lag and with many without mask mandates in place, doctors recommend that parents take precautions. Here's one doctor's advice.
A lot of families feel overwhelmed by this recent surge and don't know what to do. What we do know is that children can be in school safely if mitigation methods are adhered to. So that means universal masking. In some school situations where masking is not universal, parents can make sure that their own child continues to wear a mask.
So a lot of things are going on, Manila. Just earlier this week, 1,000 kids in Mississippi tested positive for the virus. And that meant thousands more in quarantine just as their schools reopened there. And then on the other hand, you have California. They're trying to set an example. They are the first state in the nation to require all public and private school teachers and staff to get vaccinated, or they get subjected to weekly COVID testing.
Now, speaking of vaccines, we haven't heard any updates, have we, about kids 12 and under getting them?
Well, actually, in a letter to the FDA, the American Academy of Pediatrics is urging them to speed up the process of allowing vaccines for children 11 and younger. But as we wait for clinical trials, which takes at least 6 months, and for that set approval, doctors are urging parents that if you want to protect your child right now, you can get vaccinated or make them wear a mask to school.
Yeah, still a lot to learn about how it affects children.
Yes.
Producer Roselle Reyes, thank you so much for digging into all of this.